Hello, investors. Welcome to another 180 Markets Raise Day edition. Friends, as you know, we are in the golden age of medicine. We are trying to solve some of the world's biggest problems. And that's why we're so excited today, because on this Raise Day, we are going to help Living Cell Technologies find the cure for Parkinson's disease. That's right. Sadly, Parkinson's affects so many people, makes their lives so bad at the end. And if we can solve this problem, what a huge, huge, huge win that would be for everybody. And with us today, we are joined by Dr. Carla Sue, and she's going to explain how Living Cells works, their product, and also where they are in the stage of trialing. And with that introduction, welcome to 180 Minutes with 180 America, Carla.
Thanks, Greg. It's nice to be here.
Excellent, excellent. Hey, Carla, everybody's got a story in the background, and people invest in people as much as companies. Can you just tell us in a few minutes about yourself?
Sure. I'm a non-executive director of LCT. It's a biotech company, but my background and my former life used to be, or what is still, as a professor of neurology. So I am a clinician. I look after patients with Parkinson's disease, and I'm also a neuroscientist and do research into trying to find new treatments and understand the biology of Parkinson's disease and neurodegeneration.
Yeah, and can you just explain maybe from a high level, how does Parkinson's affect the brain? And the reason I'm asking the question is because then we can get into a little bit more about how you're trying to solve the issue.
Yeah, no, sure. It's a great question. Parkinson's disease is the second most common neurodegenerative disorder. It comes from a degeneration of brain cells, particularly those cells in a part of the brain called the substantia nigra. What these cells do is that they help to coordinate the movement. And so patients with Parkinson's disease, when they have this disorder, they have a slowness of movement because these coordinating pathways aren't able to function well. And they have a lot of other different types of symptoms and signs, like tremor, difficulty in walking, loss of balance, and a loss of mobility. So it really affects people's lives. And really, in most of the patients who have Parkinson's disease really have their cognitive or their intelligence left unaffected. And so it can be quite a crippling disease whereby, you have a lot of disability, but you're still able to perform the normal functions or the other functions of your brain. So this can be particularly frustrating for patients who have this disorder.
Yes, as I'm sure pretty much everybody would know, it's got to be incredibly frustrating for these people where they actually see what's happening, but they just can't stop it, right?
That's right. And a lot of our patients say that they really get frustrated by this loss of mobility and the ability to do, their day-to-day activities.
Right. And so, turning towards, we know the problem now and the potential solution. Can you just discuss how Living Cell is working on it and your NTCL product and how it basically could solve the problem?
Yeah, well, as we said, there are several problems with Parkinson's disease. One is that you lose the cells that create a chemical called dopamine, which is deprived in the brain. And so most of the treatments try to, at the moment that we have available in 2021, are looking at trying to provide that loss of chemical or neurotransmitter. But there are two other things that we need to do. One is to replace the cells that are already lost by the time the patient comes to the clinic with their symptoms of Parkinson's disease. And the other thing is to slow down the degeneration of the brain cells that are being affected in Parkinson's disease. And that's one of the greatest challenges and one of the greatest opportunities to solve this problem in the future.
Yes, and speaking of that, can you just talk about NT-cell and just how does it work?
Yeah, so NT-cell is a product where it basically provides growth factors to the brain in an environment. It's a really cool thing. It basically is a product which is encapsulated. It encapsulates a living cell, which has been derived from pathogen-free pigs. It comes from the choroplexus, and what the normal function of the choroplexus is to secrete growth factors within the cell environment. Now, LCT's worked out a way to encapsulate these cells such that they can remain alive such that they can respond to the environment, but not actually be destroyed by the host, the patient, the subject that's having the treatment. And so these cells act as little growth cell factories. And so they can provide all of the ingredients, I guess, for the cells to survive that have been lost in the pathological process of Parkinson's disease. And it's that key factor of being able to respond to the environment by being sequestered in this encapsulated gel, such that it can respond to the environment. And that gives us an advantage of, because, you know, we as scientists, as humans, have not been able to work out a way to provide those growth factors in response to the cell environment yet. So this technology is now taking advantage of a product that can do this naturally, but allows you to not reject it because of this encapsulation.
Right. So it's actually living and encapsulated, and that's what is the, I suppose, secret sauce, if you will, from a high.
That's right. It's a living cell technology,
exactly.
And but is protects the human. And our clinical trials so far have shown that it is a safe product. We've gone through the trials which have demonstrated that this is a safe procedure to undertake.
Right. And speaking of trials and staging, can you just talk to us? Where is LCT in the whole framework from beginning to actually helping people?
Yeah, no, that's it's already performed the first couple of clinical trials on this, which have been absolutely helpful in terms of determining that this procedure is safe. And so the phase 1 clinical trials have been completed. And we know that from the phase 2 clinical trials that we know the dose and the concentration of cells that we should be implanting into the patients. So that they've been very, very helpful indeed to inform what we should do next, so that we can show that this treatment is going to be a great treatment for patients with Parkinson's disease.
Right. So we are certainly on a path moving forward. And can you just talk about, obviously, you need capital. We're here to provide capital because we want to help solve this problem. It's as you say, I forget the numbers of how many people it affects, but it's a huge, huge, huge percentage of the population. Can you just tell us about what would be upcoming in the next set of trials?
Yeah. So what we want to do is demonstrate or do a further clinical trial, a third one, which shows that we can that these cells actually protect the neurons or the brain cells from degenerating. So our preclinical data, they were done in animal models, that demonstrates that this product does preserve the neurons in those models. What we want to do is demonstrate now by using new technologies that have built on from those first clinical trials to demonstrate that it preserves the life of neurons in patients with Parkinson's disease.
Right. So you're obviously much further along. So would the goal to be see, as we know it's safe now, but to also see efficacy?
That's correct. Yes. Okay. So one way that we'll be able to do that is to the patients who will be having the treatment will be scanned to see that there is preserved dopamine from the cells that have been preserved. So we want to see that those cells are surviving for longer. And we now have new state-of-the-art technologies that we'll be applying, which include new scanners that can detect these and measure these compounds in vivo while the patients are undergoing the treatment.
Yeah, and it's also a good point to for living cells, because of new technology that's out there to test and to see what is really working. Is that also something that is maybe new that just wasn't around 20 years ago?
Yes, that's our plan. We want to use these new technologies. When the original studies were done, this is back, about 5-10 years ago, these levels of technology were not available. So we have better resolution, faster machines to actually look at the effects of this treatment with a greater accuracy and a greater resolution. So we're confident that that will be the way to demonstrate the efficacy at an earlier time, and also with hopefully less patients that are required.
Yeah, it's just incredible the difference in medical technology or medicine in general even as you mentioned, in the last 5 years. And that's why I said in the introduction, we're in the golden age of medicine. And do you also feel for LCT that that gives you a exponentially better chance of success than maybe a testing in 1985?
Yeah, no doubt, no doubt. This is the great thing about our society, as you say. The advances in science are phenomenal. They are accelerating, and what you're able to achieve now and what you're able to see. We all know, like for example, with TVs, we've gone from black and white color TV now to 4D. All of the bells and whistles. It's the same with science. And along with that, as well as much as science advances, so does the success of our human population. So the problem about aging and trying to age well now, not just aging, people are living longer, 60s, 70s, 80s. We're all looking at longer lifespans. And so the challenge of aging well is important, and one of the things that we're trying to address with scientific advances. And you asked how many people are affected with Parkinson's disease now. It's a disorder that becomes much more common in the aging population, and about 1% of patients or people over the age of 65 are at risk of developing Parkinson's disease.
Right,
So
and I'd imagine it keeps going up as people live longer. And as you said, it's such a critical element of, it's one thing to live longer, it's another thing to live longer in a productive mannerism.
That's right. Yeah. Yeah. And, as 60 is the new 50, 50 is the new 40, so we're all trying to live better and live well. And, we're hopeful that this product will help that.
Absolutely. Hey, Carla, I know that you are an incredibly busy person with all of your different endeavors. And so we appreciate your time. Do you have any closing remarks for the audience?
Look, I think that this is a great opportunity to help patients with Parkinson's disease. Living cell technology is trying to do that. We are very hopeful and very excited. This is in the context of these sorts of therapies, cellular therapies and regenerative therapies in this field. And so it's a great opportunity to help advance this field and help patients and in the community as well. So I hope everybody gets on board.
Absolutely, Caroline. And that's why we're so excited about your company and here to support you. Caroline, thank you very much. And we really look forward to the next number of years with you.
Great. It will be great to do a partnership with you guys. Please.
Thank you for watching another presentation by 180 Markets. Don't forget, if you want access to thousands of ASX capital raises, head on over to 180markets.com.au, sign up, and get on board for our very next capital raise. Thanks for watching.